Welcome everyone to Health Leadership and Learning Network and our discussion again today about patient navigation and the changes that this current pandemic is driving for the industry and for the role of patient or health navigators. If you've just joined us, you will notice that your voice is muted. You are on mute, and your video is also off. If you have any questions for us as Rosemary Kohr is running through her presentation, please type them into the chat line. I'll be monitoring them and fielding them to Rosemary. The purpose of our discussion today is not only to reflect on the current situation and its impact on patient navigators or health navigators, but also to consider what the future is going to be holding, the new future is going to be holding for all of us in this space, for our health system, and for us as educators as well, in terms of the programs that we would like to make sure that we prepare for use by the larger industry. And it looks like everyone is in. And today we have back, if you're joining us from the first webinar, if you're on with us the first time, welcome back. If you are brand new, thank you for joining us today. We have with us presenting Rosemary Kohr, who is our program director for patient navigation and for wound care. And Rosemary is not only an RN and PhD and instructor for us, but she also teaches at several universities here in Canada. And she's a very recognized and established face in the wound care sector. She's also the creator of our patient navigation program and is the person that's really been spearheading it for us here at York University and into the larger community. Yes, good afternoon, everyone, and welcome. So I don't want to hold the presentation up. I want to make sure we have enough time for questions. So again, anyone who just tuned in, please use your chat line to communicate any questions or thoughts with us. Today is around, reflecting on the role of the health or patient navigator and where we're going now in this new normal with the pandemic driving so much change. And Rosemary, can I pass it over to you?
Great. Thank you very much. I hope everybody can hear me okay. I want to welcome you from New Brunswick, which is where I am living. Moved here about 5 years ago. And, certainly we're all across the world and in Canada really dealing with what's going on with this pandemic and how people are talking about the new normal. I mean, now that we're sort of seeing maybe a, flattening of the curve in terms of the increasing numbers, for example, we're able to start to have those discussions around what is this going to look like for all of us in the future. And certainly it's not the normal that we're going to go to is not the normal that we lived in previously. So, I think there's a lot of, I look at this as being a real opportunity for change, and I think in a good way. So can we maybe have the next slide, please? Thanks very much. So we, as Tanya mentioned, we had a session in the couple of weeks ago. And in that, we had quite a discussion around what some of the issues are that we identify. And some of these issues are around, so I just kind of, went through and looked at a bit of a summary to see where are places that we're going to really be looking at that change happening and what those, what that drive is going to look like. So in terms of communication, I think one of the biggest messages that we've certainly seen has to do with the accuracy of information that people are receiving. Accurate in terms of the actual information and also timeliness of information. paying attention to health literacy. So, from my perspective anyway, I think that's one of the big things that healthcare professionals really have to pay attention to, particularly in our changing demographic. We need to really be aware of, what that looks like. Technology is another place that is really important, because what we see is when some of the things that have happened recently that have had nothing to do with the pandemic, but for example, the terrible tragedy that occurred in Nova Scotia. One of the things that is clearly going to be identified and that we can look at as something that we have to address is, what is the access to technology? So, providing information on Twitter or Facebook or through the internet is great if you have access to Twitter and Facebook or TikTok or whatever it is that you're using, and or the internet itself. So if you live in a place that, and I know certainly from having done consultation work in various places in Canada, that there are places where access is really limited. So, how do we get information across to people? And patient navigation, if you think about the role of a navigator, is really someone who can be a liaison. I talk about this a lot, but to me, it's really a big part of what that role is. And it's a really important thing to pay attention to, how we are able to share information with people. So the information that they're going to be able to understand is one thing. And the other thing is that they have access to the information. So using the technology in a way that's going to be the best for, that demographic, for example. And the other thing that we really need to consider, or the other things, are around the scope of the navigation role. And so, I've kind of identified a couple of things just in terms of proactive connecting. So before, something becomes a crisis situation, to be able to have those linkages established in advance. So by that, I mean, really taking the sort of pulse of your community to be able to know who to tap into, what are the resources. And one of the really interesting things that I think has come out of this, the COVID-19 or this pandemic, is that people are really thinking about being more creative with the way that they're connecting. They're being more creative with identifying resources. So people are, really sort of coming to, they're responding to the problems that they're identifying in very creative and interesting ways. And I'm hoping that a lot of those kinds of things can be used as we sort of move into whatever the new normal is going to look like. So, I think for people who work in healthcare or who are connected to healthcare, it's a really good time for us to be able to do that. The other thing that we need to pay attention to is the fact that some of the systems that were working before may or may not be open, they may not be functional. So it's important to find out, if they're not, are there alternatives? So some of the churches, for example, if they are not able to, up to now, if they haven't been able to, bring people into their organization to get services or help, what are some other ways that they're actually being able to do that? So, it could be an organization like a church group, or it could be something like the Y, or, other community kinds of services. So what are the other sorts of things that people are doing? And, one of the other points I guess I want to make is that patient navigate, one of the really great things about patient navigation is it offers, and I call it patient navigation. I know that people call it health navigation, or there are a number of different sort of titles for the role. To me, patient navigation, the reason I use that is because I consider the patient is truly at the center of what we're talking about. It's not health per se, it's not cases, it's not discharge, it's, you know, it's a lot more than that. It's really looking at that whole person who is really a product of their environment. And I think one of the advantages in to be a patient navigator is the, you know, the sort of characteristics, and we certainly talk about those. Some of the characteristics are things that really are kind of emphasized by this current situation that we're in, because they really give opportunities for creativity, thinking outside the box, you know, really looking at how do we plan differently than the way we've been planning? How do we create flexibility in our resource allocation that is going to be different from the kind of, you know, regulatory function that we may have seen before. So I think there are a lot of opportunities. And one of the things that I noticed was, you know, with the kinds of positions that you have, you know, we have social workers, pharmacists, physiotherapy, occupational therapy, respiratory technicians, people working in mental health, people working in pediatrics, in community, in First Nations, kinesiology, diabetes, disabilities, you know, just to name some of you in terms of your current occupation or your current role. So, you know, I think it's really interesting that there are lots of places where your skill set is going to be particularly valuable. So can we move to the next slide now? Yeah, so talking about the new normal, you know, the new normal is really, and if you listen to the news at all, you know, and I try to limit my news time, but if you listen to what's going on, you know, the conversations around around routines. So helping people, this is sort of, you know, thinking about helping people around dementia, because there are people with dementia, again, have routines that work well for them. People with autism. And so people with, but you have to sort of consider, you know, families that are involved in that. And, you know, what are the other kinds of conditions that require that new normal, those extra navigation skills? So I just, you know, I think also to ask you, you know, think about what are some of the, you know, I've named two things that strike me right away as being places where the routine change. I mean, people with dementia who are living in long-term care or who are living at home and have ordinarily go to adult day programs, or kids with autism who have special programs in the school system, or who have special additional care providers who come into the home. So what are the, you know, families are struggling, people are struggling with managing this. So, you know, what are other kinds of places that seem to, that you would consider needing that?
Rosemary, I've got someone in the chat line who has said cancer patients, and someone else who said mental health. There are many gaps in mental health. There are many limitations with technology access and the understanding of the medium. There are many gaps in mental health. Someone else, Alessandra, has said learning disabilities.
Right. So when you think about, you know, the navigation skills that we are going to need as we sort out what's going to happen with the changes that are necessary with, you know, with dealing with the sort of, you know, we're not through this pandemic by a long shot. And it's really not well understood in terms of, you know, the kind of what this virus even is doing or what it can do. So, when you think about it's the uncertainty that people are facing, along with the uncertainty that they face in their diagnosis or in their condition that they're living in. So, as you were saying in terms of oncology, this is something where people are looking at elective surgeries. And so elective surgeries that may be elective from a surgeon's point of view, because, it's not life-threatening, you're not going to die. But for someone who has a diagnosis or a situation, for example, with, a hip replacement, when you look at something like this that has significant impact on someone's life because they have mobility issues, they have pain, this is something that affects their quality of life, et cetera, et cetera. As a navigator, how can we help people get the resources that they need? Navigation is not about solving the problem. You're not going to be able to change the fact that this person needs a hip replaced. But what you, as the navigator, can do is try and figure out, so where are the sort of touch points or the hot points that I can help that person maneuver through the system so that they get what they need. You're not the counselor. It's the same thing, but you can put them into a situation where they have access to counseling. Same with mental health issues. What are we able to do around as navigators that will help to maybe find resources that are not necessarily those routine regulated resources. How are people accessing care in different ways? So, the fact that physicians and others are using virtual approaches to providing care, this is, again, going back to technology, this is something that we're able to begin to use. So lack of control, I think is another big feature in what people are dealing with as part of the new normal, is just that we don't know. So seniors, what are the sorts of issues that they're identifying? Pregnant women, particularly around the news. Sorry, I have a dog here sleeping with me, and she's dreaming of deer. So I don't know if you can hear her, but I can hear her. Sorry, I apologize. That's what's going on, is my dog is dreaming. Pregnant women. There was a woman in the US, there was a headline that a woman in the US lost her baby because she had COVID-19. And, she was, went into premature labor and lost the baby. And, if a pregnant woman or a pregnant family hearing that information is, how do they feel about that? How does someone feel when they're going through a pregnancy? And where are places where, as a navigator, you can be one of those people that is able to provide information, to be supportive throughout a process. So you're often people will say that the navigator is the one consistent face they see. So is that something where you can call and just connect with somebody and say, is everything going okay? Students are dealing with all kinds of fallout from not having summer jobs, for example. So how do we make that work well for them? Where are places where students are not, if the universities are closed, what are the healthcare, what are the health clinics doing on campus? What are they able to do for students? Those are places, again, where navigation can really play a role in supporting what's going on. So the other pieces of this, we can identify that caregivers are overwhelmed and need a break. So caregivers being healthcare healthcare providers, doctors, nurses, respiratory techs, everybody who works in that kind of environment is stressed out and anxious about what's going on, who does their grocery shopping, etc. So what are the places where navigation can smooth over some of the issues that they're experiencing? Because I think this is, like I said, this is sort of, this is a new normal. This is different. And we really need to think about the mental health of healthcare and essential workers and their families. We see all kinds of images and interviews on the news about how healthcare professionals are coping with kinds of things that they're doing and what's being provided to them in terms of support, but also in terms of support from just being able to touch bases with people to say, is everything going okay? What can we do to help? Where are the places that you might need, the hot points that you might need some help?
Rosemary, there's a lot of discussion in the chat too, dealing with communication and incorrect information, or helping people find information that is a gap right now, like in surgery. And right. It would seem that the navigator is stretching, the role of the navigator is now stretching that communication role instead of being working just with the specific issue at hand, like the surgery. They're going well beyond that in order to maybe even advocate or pursue what the end result will need to be, or discussions with the provider, say, of the surgery or the other service, as well as now helping to mediate between incorrect information that's just out there in the media, and to help people understand what the real information is so that people can calm down and feel that they are in control of their health.
Absolutely.
I hope I've interpreted that correctly. That's pretty what I've been reading. I hope I've interpreted that correctly.
Yeah, and I think that's, it sort of brings up the whole chaos of the situation, that there is a lot of chaotic kind of information. Someone mentioned to me the other day that when there was a rumor that the liquor stores were going to close. And in Prince Edward Island, this rumor rumors start, right? So this rumor started that the liquor stores were going to close. So in Prince Edward Island, there was a run on the liquor stores. Of course, people, rushing to the liquor store. This was before there was sort of a real concerted effort around social distancing. So, we have to be able to manage the chaos of these sorts of things and recognize that reputable, to really guide people. This gets back to the whole thing about health literacy, is to be able to guide people to reputable information sources and to be able to present ourselves as being, the carriers of appropriate, justifiable information, credible information. And a big part of that, we talk about kind of what are the sorts of things that we need to be able to do. We need to be able to establish trust. People need to be able to trust that you're going to give them the information. And, my whole thing about navigation, which is that you have to be able to trust the navigator, that the navigator knows either the route, there may be new kind of roadblocks on the way, but you have to be able to recognize that there is this, that there are people there that are going to be able to support you. Are there any other, I'm just wondering if there's any other, advocacy and mediating are two big pieces. Being an advocate means, and I would say patient navigators, this is something that is a big part of the role, is to advocate, to sort of straddle the patient side of the picture and the healthcare professional side of the picture, because you have to really know what both worlds look like, which gets back to the kinds of roles that people come to navigation with. So their backgrounds, you do need to have a background that you have a good understanding of healthcare. I mean, this is not something that you can do sort of right out of, you've just finished your nursing program and, you're kind of wet behind the ears. This is what you're going to be able to do. This is something where you do need to have that a level of experiential level, I guess, would be the thing I would say. I mean, you can do it, but without. But I think it's probably something that is a big chunk of this relates to experiential learning and experience living in a community, knowing what's out there, the resources that are available to you in the community. Can we have the next slide?
Rosemary, just a question as I'm reading through this, through people's comments.
Sure.
It would seem, yes, the communication piece or the communication skills, and then the scope of the use of communication has increased quite a bit in now the net new role of the navigator. I'm curious to see, in the past when we've been running programs and meeting with patient navigators, not everyone is doing this as a full-time role. People have been doing it as part of their larger role. And I'm wondering how many people on the line here actually are still doing patient navigation or health navigation at part-time as part of a larger role. And I don't have my poll up, but if anyone just wants to, say in the chat if they're doing this as part of a larger role. Feel free to just type it into the chat.
Yeah, and I think that's, that's certainly, I mean, my whole coming into patient navigation was, there wasn't anything like there wasn't any sort of defined patient navigation when I really started functioning as a patient navigator. And I'm sure many of the people on the call today have had that experience too, that you kind of evolve into, now we have something called patient navigation or health navigation. But really this wasn't until the 1990s, towards the end of the 1990s, that this was actually identified as something specific. So before that, when I think about all of the time I spent working with patients and their families to sort out multiple issues that were often sort of corollaries to whatever their major healthcare concern was. But they were the things, these were things that were preventing people from going home, things that no one thought to ask. How many steps do you have outside your house? Well, my house is all on one level, but you have 7 steps that you have to come up before you actually go in the front door, and that's the only way to get into the house. So, things like that. Why is it that patients would come back into hospital after being discharged and, for a few days, and they'd be right back in the hospital again? So, really understanding that patient navigation or health navigation or system navigation, whatever you want to call it, is something that really addresses those multiple issues and those multiple needs. And it really does require, I think what we're seeing happen is that we're looking at creating a way, a program, more of a program around patient navigation where it's legitimized. I think that's one of the biggest issues, is that there needs to be legitimacy for the role, so that healthcare professionals and healthcare providers and families are able to benefit most from, having patient navigation in place. And, this slide, that when we're talking about sort of where this can go, and how we can look at patient navigation, this is really, a framework that I think would be the most effective approach to patient navigation, which is really ensure, and this is, there are a number of reasons why I think this works effectively, But, the main thing about this is that we really need to identify this collaborative team process, that this is not sort of a single entity that does all this work, because frankly, a patient navigator, like anybody in this sort of role, you burn out awfully fast when you're faced with the kinds of situations that you're faced with. So in my kind of view of this would be a patient navigation program, which is the program. So it's in the organization where the person comes in to have care provided, whatever that is. And we were talking the last time about, having some kind of standardized risk assessment. Well, first we were talking about, a standardized risk assessment for COVID-19. But when you're really and my sense is that when we're talking about a risk assessment, I feel that we have, we have components within our demographics that I'm sure if I said to you, so write down the sort of 5 main characteristics of your population that cause risk, that are stressful or cause risk. You could easily identify what those are. So, we don't need, it's great we can have research that backs this up, but I do think that you can probably identify what those standardized risks are for your population. And you can also identify what the needs are that they have in order to mitigate what those risks are. So diminishing the risks, right? So if you have a program that is set up that says, okay, this is what we're looking at overall, globally, this is the kind of thing that we need to deal with, then you can begin to look at who populates as a navigator, who populates that. So, I've got this middle kind of group here. So surgical care navigator, but it could be any, it could be the disease specific. So it could be oncology, and it could be oncology. It could be, gynae oncology. It could be breast cancer. It could be, prostate. It could be like, you can have specific kind of navigators within each one of these areas. But you can also have a more general, I worked in medicine, in the medical care program. So we had multiple, we had all kinds of things going on there. So, it could be something around, dealing with acute pancreatitis, or, an acute episodic situation, someone is going home or they're transitioning. So then you have transitioning navigators, right? Or system navigators who can help with the kinds of things that those specific disease-specific navigators are not, that's not their job. That's not what they're, that's not what they have, their sort of expertise is in the disease process that they're dealing with. So the transition navigators are people kind of, as you're moving through the system, who helps with that and links up with the disease-specific navigators. And then the patient navigators, community navigators, Aboriginal navigators, those are people who are, again, embedded in that particular demographic, or who are dealing with that particular demographic. So it could be things like, some of the mental health issues. It could be dealing with substance abuse, a variety of specific issues but things that require a healthcare professional, so a regulated healthcare professional. So that middle bar to me is where you have, you need to have people who have a background as regulated healthcare professionals. And the lay navigators, the important aspect with having lay navigators is that the lay navigators are the grassroots people that you need to have in place. I believe that you must have them in place in order to make sure that things are going the way they should be going. So, they're the ones that are calling people on the phone. They have, they may have a script that they use. Lay navigators are not people who necessarily have, the regulated healthcare profession degree, but they are people who have experience either from having had, cancer themselves or whatever, and have gone through a training process. So, these are important things. So peer support is really important. And really, when you look at what works well for to keep people home or out of, getting into the weeds of healthcare, the best way to do that is to ensure that they have that kind of continuous, not every day, but that they have someone who is available to them. They can phone them, and that person can call them as well. So, it's got to sort of work completely together. And I think that one of the things that I see with the pandemic is that there is an opportunity now for people to be able to take advantage of information sharing in a different way. So going back to what we were talking about with, communication, with using technology, there are lots of different things that we can do that are less, they're less resource heavy and more relevant to what people actually need. So, instead of somebody having to make an appointment and come in, that they can actually either make an appointment on a self-scheduling appointment app, and they can have a face-to-face, contact and discussion with somebody from their own home. So, just like this, right? A similar, only not with this number of people, but, something that would work effectively, so without having to go anywhere. And I think, even the Prime Minister talking about, virtual parliament, like, why not? What virtual meetings? I think that's the other thing that we're going to see coming out of this, is that people are happier in some senses to recognize that they can actually do work from home. So you may disagree with me if you have small children and they're driving you nuts, but I think there are some alternatives to the way we've done things just because we've done them that way. So,
Rosemary, we have a comment, which I'm going to turn into a question from the chat line. And it's about the Lay Navigator. It says, what gets confusing to the public is when you, I guess, use the same name for the lay people, or lay navigator, I guess, versus the health professional. And I've seen the use of the lay person in the health coaching literature to support the work of the health coach. But do you feel there's any, or is there any evidence for the use right now of lay people in patient navigation? Or on the flip side, perhaps there isn't, but there is other work that's been done, perhaps right at the front line, using lay navigators. I mean, any comments on what evidence we can actually draw on, and also the name of the lay navigator, how they really should be termed, or some guidelines on how they should be termed? Rosemary? Odette, can you come on the line for a second? I think Rosemary has dropped off the call.
Yes, Tanya, I'm here. So let me just connect with her quickly.
Okay.
And see what.
Sorry, everyone. Technical difficulties. We'll just wait for her to rejoin. Thank you.
She's there.
Thank you. Here she is. Coming back in. She may be muted, Rosemary. She may be muted.
Yes. Let me.
There she is. Unmute.
Thank you. I don't know what happened. That was technology. So something happened. Can you hear me now?
Mm-hmm. Yes, yes. Thanks, Rosemary. Sorry about that. Rosemary, and I was asking a question. I don't know if you heard it before you signed. You were, thrown off
Jumped
the.
out. I was.
Yeah.
Yeah. Okay.
But what do you think of the way the lay navigator is termed so that it prevents any confusion with the healthcare professional or the licensed professional that may be also a patient navigator?
Well, it's a good question. I mean, it's the whole thing about nomenclature for, I mean, we struggle with this I know in nursing we struggle with this because you have, I'm a nurse. Okay, I'm a nurse. I'm a registered nurse, or am I a registered practical nurse? A registered licensed nurse, a registered depending where you live and practice, a registered psychiatric nurse. So an advanced practice nurse, a nurse practitioner, you're a nurse. If you talk to a physician, well, I'm a physician. So, okay, I know what a doctor is. So we've sort of created the opportunity, I guess, for confusion. My thinking around this would be that, the title or the sort of role is a navigator. To me, everyone is a patient navigator, but, again, I know that other people have different titles or ways of looking at this. But I think as a patient navigator, there is then kind of under that is then the subtitle, I suppose. So, I'm a lay patient navigator. You still have to explain what that is. And, in the course, one of the things that we talk about is, your 1 minute or your 30-second elevator speech to say, who are you? What do you do? And my experience with that goes back to as a nurse practitioner, because when I first started as an acute care nurse practitioner, no one knew what they were. So, what does that mean? So you'd have to go in to introduce yourself to patients and their families often, and in 30 seconds explain what it was that you did that was different from, you were still a nurse, but how is this different from the nurse who's looking after me at the bedside? So I think I agree. I mean, I think that it is something that has to be thought out. So these are all components that need to be carefully thought out. So absolutely, I agree. It's something that has to be it has to be articulated. And this is, you got to remember, this diagram that we have here is a very simplistic version of something that takes up a lot more space, but, I don't have that here.
It's Tanya again, Rosemary, and I'm wondering, since we've got everyone on the chat, if anyone can just put in whether they do currently work with people who are not health professionals, who may be in that lay navigator category. Because it's present for us all. It's there, people are utilizing them. So as part of the sort of the framework for the navigator or the health navigator, it does need to be addressed in a more fulsome way. So if anyone wants to comment on whether they're currently working with anyone that may be in that lay navigator or peer support navigator category, even share what they're currently doing. Someone here says they're a community care coordinator for the LHIN. So we've seen those as well, yes, through some other community groups that we work with.
But one of the points I want to make about that as well, in terms of
coaches.
One of the points I just want to make, though, is that we have in the past, this is where I think we have to look with a different lens, because in the past we've looked at sort of limiting how do we define community care, or how do we define the kinds of engagement that we have within the community. I think we have to expand those. So that's the other thing that I think we need to keep in mind, is that it goes beyond our current boundaries, our current limits of how we, who we talk to get support. So Tanya, can you?
People are saying they're community care workers themselves for the LHIN. And that their role, I guess someone is saying a little bit more expansively, they liaise with other mental health agencies, outreach workers, and peer support workers. I guess that's as a navigator, perhaps. They liaise with mental health agencies, outreach workers, and peer support workers. Someone says the system navigator for francophones, but the scope has become too large, and they need, and I see the need of a health links model of social worker and nurse. But seeing as that does not exist anymore, I am in it, I guess, to fill the gaps. And then someone else is saying there's a lot of confusion in the community in terms of what their role is and how I differentiate between other healthcare providers in the community. I often describe myself as a navigator for patients.
Right. And I think that's, communication, information sharing, these are still fairly new. Well, they are new roles when we look in the context of healthcare, they're new roles. So to be able to, provide descriptions, that's where a patient navigation program, I think, is useful, because it's a kind of the warehouse or the clearinghouse where you can actually describe and define the kinds of services that are offered by navigators. So, that's one of the reasons why I think it becomes more of a clearinghouse, in a sense, of how that can work. And you can see in this little model, even though it's a really, simplified version, it gives you a sense that this runs all the way through. So it isn't just, the patient navigation program for the organization only addresses the disease specific or the navigators who are housed within that system, but that it goes beyond that. It's kind of like, there was a museum without walls. It's the same sort of concept of healthcare without walls. And that's the thing I think that we really are going to be looking at breaking down as we move forward, because we aren't going to have those walls. It's going to be that virtual space that will enable us to do all kinds of really interesting provisions of support in a new kind of environment.
Rosemary, someone has also said they're wondering how the restructuring of the OHTs, and we're Ontario specific, if anyone's joining us from other provinces, perhaps this is also happening in your province, but how this role will now change with the new restructuring of the OHTs. I mean, we've been trying to think of this as well, and we saw pre-COVID-19 what the goal was, which was to make this a much more permanent and expansive team of patient or health navigators, including a reach out to the community. But Rosemary, I mean, do you want to comment on what you think may now happen? Maybe it's just going to be even more growth of more patient navigation roles full-time as assembled teams.
Well, and I think from what we saw from the OHA and, from the initial sort of fielding of those teams, and looking at what the requirements were in order to become an OHT, it's clear that there is a recognition that this is an important role. So patient navigation was identified within the OHT application forms. So, you know, the teams that were putting together their applications had to say, you know, how are they going to do this? How are they going to have, and, you know, in a lot of cases, I think it's sort of like saying patient-centered care. Do we provide patient-centered care? I would say a lot of the time, not really. You know, we give sort of lip service to the concept. So the thing now is going to be really to recognize that the landscape has shifted and it's going to continue to shift for the foreseeable future. You know, this is like, we don't know. We have no idea what is really going to, what this is going to look like. We can make some, you know, the government came out with their predictive model again, which, you know, the last time they did this, it was off by, you know, 50%. And so, you know, who knows? We're just sort of going on statistical modeling. I think what's important is to consider to go back to the standardized needs and the risk assessment for your populations, and to really take a long, hard look at what those are, as opposed to kind of a knee-jerk reaction. So, you know, that's what crisis and chaos should teach us, is that within that time frame, we have to kind of hunker down and actually take the time that is needed to think about what are the needs of the population that we serve, what are the needs now, and how are those needs changing over time. And part of that is to have conversations with the actual people, because we can make assumptions about what their needs are, but it's the actual people who are living through the experience who are going to be able to, you know, help us do that. And we have technology that we can now use to access people in great numbers to get information from them. You know, that would be the way I would be looking at this. And so I think from the OHT perspective is to consider that patient navigation, or navigation of patients, systems, disease, whatever, you know, however you want to configure that, is going to need to take a front and center position, because we are dealing with, you know, if there are 100,000 elective surgeries that are now on hold, what is that going to look like? What are the needs going to be of individuals who are waiting for those elective surgeries, for example? I mean, that's just an example.
Mm-hmm.
Yeah.
So, Rosemary, to your comment, someone on the line has said, I think the most important thing that is resonating for me through this talk is the need for community and for work on the ground to help the health and wellness of the public we serve. Any commentary on that reflection? And also I want to add in, it's obvious our systems are rather disjointed, and we need to work a little bit more in an integrated way, not only across our various healthcare silos. And I mean, the big question is, how are we going to do that? But I feel it's to the point that Hope is making about the need for additional resources that can really help what's happening on the front line.
Mm-hmm. Well, and just, you know, I'm going to talk next week about long-term care, which is, you know, big issue at the moment. But, you know, just to speak to the point in terms of the need for, the need for community on the ground, you know, feet on the ground. This is something that is, I believe, a change that has been forced upon us. Healthcare has always been top down, and we have to really begin to recognize that what resonates is what's happening on the ground. And lay navigators, peer support navigators, people who are connected in the community are the voices that need to be listened to. And, you know, like I said before, that's my reason for having this kind of up and down, back and forth, you know, perspective, that we need to disassemble those silos as much as we possibly can. It's not going to happen overnight. You know, that's the other piece of this. And remember, patient navigation itself as a system was only really, has only been around since the late 1990s. So that's a, you know, that's a very, when you look at healthcare, that's a really small period of time. So we have to be patient, but I think we have to be proactive. Yeah.
Thank you, Rosemary. We're approaching time, and I'm just wary that people are probably needing to get back to work.
Okay.
Any final comments? You mentioned the long-term care webinar we'll be running. You'll see that very shortly so that you can join it. And Rosemary, any final comments? And I want to add, when you're talking about skills, what we did notice from the last webinar was that advocacy and leadership are really rising also to the top of the role of the patient navigator right now, or whatever navigation role you're playing. Leadership and advocacy are really key. I think that's where that communication skill dovetails with your role. It's leadership that you're taking to carve out the resources you need for your patients. But any last words, Rosemary, before we end?
Can we go to the next slide? Yeah, so we've really talked about this. You know, it's that positive response to change resulting from the pandemic. So we've talked about, you know, thinking about this, and I would encourage you to think about what this means in terms of the positive potential for good change, as opposed to, you know, going down the rabbit hole that it's chaotic, it's terrible. You know, I think we really, this is an opportunity. It's a huge opportunity for positive things to come out of it, but we have to really be thoughtful as we're going forward. So, and this is a view from my house, just, you know, just to put things in perspective.
Thank you, everyone, for joining. And someone saying working with your heart is what we need.
Yeah.
Couldn't agree with you more. Absolutely. We must do this all from our heart, from what we feel sincerely, and the way we want to support the industry and support all of you. And thank you for your time today, for joining us. I hope it's been an informative session. It was videotaped, so we will be sending you the link and you can share it. And there's more webinars to come through Rosemary. One coming up next week, we hope, but we'll let you know about long-term care. Can you please invite people to Facebook? Yes, Maria Di Daniele. So someone has notified us that they've set up a Facebook page and they're sharing that link right now. Of course, if you're looking and you would like to join, Piers Maria is running this and supporting this on her own. So thank you, Maria, for doing that. Someone has said they've signed up. I think, you know, if you're hosting as a community of practice or of practitioners, and you're sharing your own knowledge and your own community resources, it's a wonderful idea. I mean, we encourage many people to start this up because we don't have a one unifying body to do this for you. But thank you for joining us today, and thank you for your time. And Rosemary, any parting words?
Oh, I think just, you know, keep talking about this, keep talking to your communities of practice and your communities of patients about how we can integrate more with our communities and, you know, use that virtual space. I think that's the other, you know, really wonderful thing that we can take advantage of now. So thank you very much for this opportunity to talk about something I'm passionate about. So,
yep. And for us too, and someone is saying it provokes thought for the direction of the future of patient navigation, exactly where we're going. Thank you for supporting that direction, for helping to keep us informed about where we're all going with patient navigation. Yeah. See the contacts for HLLN and for Rosemary Kohr right in front of you, Facebook, Twitter. Again, Maria did share the Facebook page that she has set up, if you've all got that, but it'll go out with the videos in the text as well. And thank you, everyone. Please stay safe, stay healthy. We hope the best for you and all of your families and your students and anyone that's around you.
Yeah.
Thank you, everyone.
Thank you, Tanya. Thanks.